Hello. Yes, I was trying to reach Denver Health Risk Management. Is this the correct number?
Yes,
Hi
yes.
there.
Is this Nicholas Coram?
It is, yes.
Okay. Yeah, that I was just texting you because I was in a meeting.
Oh,
So,
understood.
okay. What's the issue?
I've had quite a few issues actually with Denver Health, and I sent a letter to Pam Briscoe. Is this
Mhm.
Anne Marie?
No.
What is your name?
Kim Johnson?
Ann Johnson. And you work with Denver Health Risk Management as well?
Yes.
Okay. So Kim, I guess I was calling because in Anne Marie's message, she told me to reach out to the on-site risk management director, I guess, or whoever was at the phone number 4928.
Okay.
So I guess my question being is that I've had so many issues with Denver Health, and I've taken plenty of steps to try to right these wrongs, but unfortunately I've suffered quite a bit financially, physically, emotionally, and I would like to discuss the next steps.
Go ahead.
Well, I guess what would you normally do in these cases, or what would your steps be?
I don't even know what you're talking about, so you're going to have to give me some information. What's the
Oh,
problem? What's the issue that you need solved?
okay, sure. So my issue and problem was that I believe the doctors did not provide me the standard of care that is adequate. I also believe that I have
And why do you
multiple.
believe that?
Well, I think my next point will add to say that my medical records have been changed so much to reflect.
How do you know that your medical records have been changed?
Absolutely. So I just called the medical record office to verify
Uh-huh.
that it's not possible to have future information inside your medical
It's
records.
not possible to have what?
Future information,
Uh-huh.
such
And
as
what do you
like,
mean by future information?
sure thing, things like future dates, such as like lab results that hadn't been done yet, and medications that were prescribed to me that are basically being shown that I had never actually received. I also have a physical copy of my medical records that I had printed out with Denver Health that shows a biopsy that was collected, as well as a indication with, I believe they're called diagnostic codes. Unfortunately, I never had that biopsy done, so I believe that's
Mm-hmm.
all part of the falsifying the information.
Is there a result there that from some biopsy that you think is a mistake or something? Someone
Yes,
could have ordered a biopsy and then they didn't cancel it when they didn't tell you to get it. But if there's a result there, I can look at that.
absolutely. So there is a result there
And
because yeah, with the diagnostic codes, that's how I believe that there is a
what is
result.
the result? What does the
Uh,
reading of the result say? Not the code, the result of the pathology.
dermatitis.
And it says that you had they wouldn't dermatitis doesn't you don't biopsy for that. So why would they have a pathology report that says dermatitis? Is that all
I'm
it
not.
says?
I'm not sure why that is, but I just
Well,
know that like.
I'll have to look at it myself and see because it could just be a misinterpretation, but they don't do biopsies for dermatitis. That's not a reason to do a biopsy. So I'd have to
Uh,
look at that. I can look
absolutely,
at
and
that.
yeah, and I can give you some time to look at that. So, but I just want to say that because it is inside my medical record and I have the physical copy of it being done, including the date and time of the collection of the specimen and the person who collected said specimen, where, again, none of that actually happened.
Mhm.
So, again, my next goal is just to, like, hopefully move forward with this in a very professional and
Mhm.
respectful manner in hopes
Mhm.
that you guys will do the right thing, compensate me for my time, my financial
Well,
loss.
there's not going to be any compensation for it. I'm going to look at it. If it's there and it's not supposed to be, they can document, make an addendum that it wasn't done or it was done or whatever. I've got to look at that and research that biopsy that you're talking about. If it wasn't there, if it's not supposed to be there, or if someone has a reason that it's there, I need to investigate that. We don't compensate people for their time. And what time would
Sure.
would you be compensated for?
I would say mostly the loss of time that I have had due to the fact that I wasn't receiving adequate care. The financial loss.
And you would have to define what financial loss you had related to not receiving adequate care. What inadequate care did you receive?
In what regard?
You're the one that's saying you have inadequate care. I want to know what you mean by that. What care was inadequate?
Okay. So let's say, for example, the dermatologist that originally saw me, she chose to not actually prescribe any medication for me that day when I desperately needed medication. And as a result, I was a male model at the time, and I lost my contracts. And again, just how bad I was feeling, I wasn't able to actually do anything or leave my house because of everything. So I wasn't able to work. And I can also attest to say, this whole thing has caused such a emotional, mental strain upon me that I am now estranged from my family as a result of all of this too, because just so much stuff had happened. So I'm just trying to, again, approach it in a way that's not aggressive or rude. I just would like to gain assistance and also, be compensated.
Yeah, so the compensation on my end would be a no, because, that's just not what we do. We don't just give compensation for that. But if you feel like there has been something that's been done that was inappropriate or something like that, you can take whatever course you want to take, but have you talked to the doctor?
I have, yes. I've talked to multiple doctors regarding this information. And just so you know,
and what did they tell you?
Well, I've also recorded all the interactions that I've had with all my doctors, as well as phone calls. So
and what did they tell you about the treatment? Did they give you that wasn't appropriate what you were asking for, or did they say that it was dangerous for you, or that what is it that you were asking them to do? What medicine were you asking them to give you? Because those are medical decisions that I can't override or overrule. I can't tell them what to do. They may have had good medical reasons to do it. And so that wouldn't be anything that I would be able to affect. I would have to, also ask them what it is that, because they probably have a good medical reason, and I couldn't dispute it and say, oh, well, you should have done what he said, because those are things that they know that I don't know. So It wouldn't be that I would, in an investigation, I would just read the chart and look at what they wrote and that kind of stuff. As far as the other things that you have, complained about so far, the medical record, I can look and see if that wasn't done or was done, or I could, figure out if they need to amend it and say it wasn't done. Those are things I would have to investigate. And then is that the gist of the inadequate care? That's that's all that you think was inadequate, or is there something else?
Well, I would say that is the main gist of the inadequate care, just the falsifying medical records.
I don't think anybody falsified it. If they did, if it's in there and it's not supposed to be in there, it could be a mistake. I'm not going to say they falsified it, because they wouldn't have a reason to. falsify
Um,
anything in your record, So
well,
it could be that it
they
was a
would.
mistake, or it could,
Again, I think
you
just
know.
because, like, you're in all fairness, I feel as though maybe you're jumping to conclusions without doing your investigation first.
Mhm.
You're saying
And
that
so
they
are
don't have a
you,
reason,
because I
but
feel
no,
like that you're
but hold on.
accusing people of doing things that you don't know they did. So let's just look
I
first.
do though. The thing is that I do though. I am very much
Just
aware.
because it's there and may not, it may be inaccurate, I'll say, doesn't mean someone intentionally falsified your record. So I'm not going to
Okay.
accept that as a premise. I'm going to say that I'm going to look at it and see if there's a reason that it's there or not there, or if it was a mistake, because people do make mistakes. I'm not going to put that past them that there was a mistake made, but I'm not going to go in with
Sure.
the premise that it was falsified, or it could be
Sure.
inaccurate. That's true.
So can I
So
ask you this?
I'll
Can
look
I
at
ask you
that.
this then? Um, just as
Mhm.
far as the MyChart app, I'm sure you're familiar with the MyChart app.
Mhm.
So in my MyChart app, I have multiple occasions where I can reference that the information has been changed since my last visit.
Mhm.
One, in my medical records, I have multiple instances where I can prove that the formatting has been changed.
Mhm.
Also, I find it very hard to believe that it would just be a mistake when you add dates that are so specific to different medications being dispensed. I would
Mhm.
also add and say that I find it hard to believe that it would just be a mistake that somebody would approve a medication almost a year after they allegedly prescribed it to me. And then again, because like I never took any of the medication that they were basically saying that was prescribed to me because I wasn't able to get it. But in my medical records, it's showing that I've been on them. And I don't believe that's a mistake.
Okay. And what would be the reason for them to purposely do that?
I believe that Cheryl Armstrong, the initial dermatologist where I believe this all started, she did not see it fit to actually provide the level and standard of care that is legal. I'm sure maybe I'm not using the proper definitions here, so please excuse me in my ignorance.
Mhm.
But she did not provide an adequate level of care that would basically allow me to live a life that is even fair or equal. She did,
Mhm.
however, go beyond her means in ways to hide information, convince other doctors to hide information regarding
Why?
medications that
Why
were
would they
prescribed.
do that though? Why would
Because
she
because
do
hold on,
that?
I'll answer your question. I believe that she did this because on the day that I received the medication that helped me, it should have been prescribed by Cheryl, which she chose not to do.
And so you think that was malicious, or you think that was medical judgment?
I
There's
think that was malicious.
sometimes
I think that no, I absolutely think
medical
that was
judgment,
malicious.
sometimes if they say that it's not appropriate for you,
Hmm.
that's medical judgment. She wouldn't have a reason to purposely harm you.
And I think it was malicious because at the time I did not want to get vaccinated, and she questioned me regarding why I didn't want to get vaccinated. And I believe
Mhm.
that because I told her my reasoning, it really actually upset her, and that is why she did not provide me care that day.
So you think all of this is all about you not wanting to get a vaccination, and you were penalized by not getting the care that you needed?
Yes,
Okay. And did you go see another doctor? Did you
I
just
did. Yes.
ask for another provider?
Yes, I did end up seeing somebody else and actually getting
Okay.
some help and actually getting some medication that I needed to be on to make me better. And
Okay.
I find that it took, because of how long it took me to even get to that point, I lost so much of my life. I wasn't able to work, my family.
Okay. All right, so I will do an investigation and see what I can find. I mean, I'm sure she didn't write anything in there that was, I'm going to try to harm Mr. Coram. So let me just look and see if the things that
Yeah.
I can see are,
And I
and
think
call her
if
and
that's
talk to
really the
her
case,
and see what she
if that's
says.
really the case, then maybe the potential might have just been negligence on her part that resulted in, again, physical injury as far as scars being on my face that I'm going to have
Well,
for the rest of my
yeah.
life.
So I will
And
have to let me talk to her too, and let me look in the chart and just try to, you know, see what exactly happened. I mean, she probably has her reasons, so let me just talk to her, and it won't be today. Next week sometime I'll try to get a hold of her and look into your chart and see what's going
sure.
on.
And I just want to give you one more example. I'm going to pull up the medical record right now. 1 second, please. Okay, so if I could just ask you one question before we get started with this. So if a medical record if the encounter date for the medical record is May 27th, 2021, right? That just to verify that makes sense?
I don't know. I'm not in the record, and I don't have access to it right now.
Okay.
So if you
Sure,
say it
sure.
says May 2021, I'll see that when I get in there.
Okay, so I'm looking at the medical record that has the encounter date for May 27th of 2021. So do you think it would be possible for the medical record dated May 27th, 2021 to have future information such as end dates of 6/11/2022?
It depends on what you're talking about. I can't just answer yes or no without looking and seeing what you're talking about.
Because
So
it wouldn't,
I
I
have no
don't,
idea.
so what I'm actually, this is just one example of the really blatant inconsistency in this medical record. There's talking about the end date of my primary care doctor.
I don't have an answer for you because I don't know what you're talking about. I can't see it.
Okay. So I guess,
I don't have a way to answer that.
no worries. So if you were to maybe, I'm just kind of putting this out here now because I want to just verify with you, like at least what I'm seeing and what you should look for. For example, another thing that's in here are medications that are started on May 5th of 2022 inside my medical record dated May 27th of 2021.
Yeah, I don't have an answer for you. I don't know.
Okay.
I'm not
But do you
in
think
there.
that's
I
even,
don't have.
is that even possible though? Is that possible for somebody to do that?
I don't know. I'm not the person that knows about the medical record like that. I would have to ask somebody. So
Okay.
I don't really know. I would have to see it first.
Sure. I did call your medical records office this morning to also ask them, and they said that that's not possible, that the medical record should only have information regarding the encounter date and nothing else. And that to me would be reasonable and normal, because in that way I could have an accurate depiction of what my medical records are. But
so if there are things that are inaccurate in the medical record that are truly inaccurate, we can work on removing those. But I don't know that they're inaccurate until I see what you're talking about. I have no way of knowing whether it's inaccurate or that that's a function that is supposed to be. I have no idea. I haven't looked at it, and so.
Yeah, no worries, because that's just these are my main concerns that I believe were taken, or things that were done to me to basically change my medical records to hide her negligence. And that's why I believe I have so much evidence regarding this.
Mm-hmm.
And even again, after, if we go back and we actually change the medical records to be updated correctly, I still feel
Mm-hmm.
as though I need to take actions against Denver Health to,
Yeah.
you
And
know,
so that
right
would be
people.
something that's not in my purview. Whatever actions that you take, you're fully within your rights to do those things. But what I can do is look to see if those things are correct or incorrect, and talk to the doctor, and that would be the end of my role in this case.
Okay. And then, so at the end of your role in this case, if we did find that these medical records had been falsified, what are some things that I could do?
That you can do?
Yes.
I can't advise you on that. That's something you have to decide for yourself what you want to do. I can't
Okay.
advise
Well,
you.
I would like to seek damages.
And I can't advise you on that. I'm not your
Okay.
lawyer. I'm not a person that can give you information on where to go or what to do. Those are all personal decisions that you have to make on your own.
Okay.
I'm not anybody's anything. I'm just the risk manager looking into your complaint about what has happened, and basically that's all I'm going to do is look into it, investigate it, and the rest is not
Is
in my
there
purview.
a way I could place a formal complaint other than with the state medical board?
I thought you had already made your complaint. I mean, I don't know who you would be. Who do you mean make a formal complaint to? Because
Just because.
I know that you've talked to several people and you've made your complaint a formal complaint, so I'm not really sure
Well, I don't know if my
what else.
complaints have actually been formally taken care of in that regard. So that's why I just want
Yeah,
to make
they've
sure
been
that.
investigated. I'm the last stop for the investigation. So you don't need to file anything with me. We're talking right now. I'm going to investigate it. There's no formal complaint. The rest of it is up to you. That's what I'm telling you.
Did you
I'm
say
going to
they've
do what I
already?
told you I was going to do.
Did you say they've already been investigated?
As far as I know, because I haven't heard anything about any falsification or inadequate care, but I will look at that too and see if
Okay.
there, what the investigation entailed. I know you've talked to the patient advocates. Those are the people.
I actually haven't talked to patient advocacy. I made multiple attempts to get in touch with them, but they have not reached out. So I think
So I'll find out
be helpful
what.
if I was able to get in touch with them.
Yeah, you just leave a message on their phone, or however they tell you. You call the number and they'll tell you what to do. And
Mm-hmm.
did you write them a letter? Did you do something like that?
Well,
Those would be.
as I've left many messages
Mm-hmm.
with the hope of receiving a call back, I have not received a call back, and I know that they said they would reach out within 24 hours. So I don't know if that's a violation of your hospital code to say, like, I don't believe, again, even I'm receiving adequate care there, and more or less a violation of my rights, set forth by Denver Health to not have an understanding of my health care.
Mm-hmm. Okay. Well, I'll look into that too.
Okay.
But yeah, I'll look into all those things and see what's going on. But right now, I need to go back into the meeting, so
Okay.
I will thank you for calling me and letting me know, and I'll look into it.
Thank you, Kim. All right. Have a good day.
All right. Bye-bye. You too.